bold statement, your heart is important. In all seriousness, there is a lot of opportunity and a lot of occupations that go just to make sure that your heart works. Obviously, without the flow of blood, you're not going to last very long. So today, we're going to talk about the flow of blood within our circulatory system. So first of all, let's talk about some characteristics of the heart overall. So its main job is to pump blood throughout the heart. It is a muscle. If you remember, we looked at cardiac muscle, so we were actually looking at muscle from the heart. But we also see, just with this diagram, we see that there's obviously some veins. We see that there's some arteries involved. And the heart, when we draw it in pictures for like Valentine's Day, it's not necessarily that type of shape. It's actually more of like a bell pepper, a green bell pepper that kind of comes to a point. And it also, if you look on the exterior, it itself has blood vessels that come to it. You can see that it does have some fat tissue that's on there. It also has a lot of nerves that are around it because it's actually getting signals by our brain saying to pump. And so there's a lot. It's a very, very complex thing and obviously very, very important for us. And so we want to talk a little bit about the overall structure of what is all involved with the heart. So it's about the size of your fist, or again, that green bell pepper. It's about a pound. The apex, so that tip that I was talking about, kind of points towards your left hip. So when we do our Pledge of Allegiance and we put our hand over our heart, we always use our right hand. And so the apex of it, if you think about it, is kind of right beneath your left breast. And it sits a little bit towards our left side. And so it also means that our lungs on our left lung is slightly smaller than our right. And it also has its own kind of tissue that surrounds it. It's called a pericardium, just to make sure that it kind of isolates itself from the lungs. And so here's kind of what the diagram looks like, or the anatomy of it looks like. So again, our left lung is slightly smaller, and it actually kind of sits in between the lungs, if you kind of imagine that. And it shifts to the left. And the diaphragm is the muscle that goes underneath the lungs. It doesn't necessarily have an impact on the heart at all, but it does impact, of course, the sacs of the lung, as we'll learn about in our respiratory video. And so that just kind of gives you a little bit of anatomy of the heart. The heart has different layers to it, and the muscles that are involved are the epicardium, the myocardium, endo, epi, outer, myo, middle, endo, inside. And so just know that it is an organ. It's made out of many tissues. Remember, a group of tissues working together creates an organ. And so when we look at how the muscles are arranged, we look at it somewhat smooth, but it's actually kind of got a lot of different twisting mechanisms to it. Specifically, the cardiac muscles kind of create a figure eight pattern. And so if we talk about that bump, 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 bump sound, what's happening is we are squeezing the atrium muscles first, and then we squeeze the ventricle muscles. So there's a lot of videos that you can watch that go out that basically you squeeze the top and then you squeeze the bottom. Blood flows in at the atria. It then will flow to the ventricles, and then it's pumped out after that second squeeze. And so there's kind of a lot of arrows that are showing us here. Just remember that we have the anatomical position, so it's left side and right side. Even though this is our left, this is our right, the anatomical position, it's flipped on us. So atrium are the very top. The way that I tell students to remember this is if you've ever been in an atrium, it means that there's like glass windows that are above you. That's what makes it an atrium. So atrium are always towards the top. Ventricles, they are going to be these bottom parts. And then right in between, you have what's called the septum. You also have a septum that separates your nostrils. So if you stick both pointer fingers up your nostrils, go ahead and do that right now. Just kidding. There's a skin that is in between your nostrils, and that's called a septum. Same thing that's in your heart. And then valves are found all throughout. There's 4 of them. Valves are found all throughout the heart just to make sure that blood is only going in one direction, kind of that highway system that we talked about with the cardiovascular system. All right. And so it's called a double circulation loop. What we call the right side of our heart receives the deoxygenated blood, and the left side receives the oxygenated blood. And then the 2 different circulations, you have what's called the pulmonary. Anytime that you hear the word pulmonary, it deals with lungs. And so pulmonary just deals with the blood that's coming to or from the lungs. It's got its own circuit because that's where it's getting action or getting rid of the carbon dioxide. The systemic circuit is all the other parts of our body, and the blood is being delivered, and and so you're seeing those red and blue colors. Just remember that that's oxygenated versus deoxygenated blood. And so if we look specifically at the heart, look at the arrows. So deoxygenated blood that comes from the lungs or comes from the body enters the right atria. It then is going to be pumped through the what we call the atrioventricle valve, atrium ventricle valve. It stays in the ventricle for a little bit, and then on the second squeeze, the blood, will be pumped out through what's called the semilunar valve. And then there it will go throughout this one's going to the lungs, this one's going to then go to like the body. And so we see the flow is very much in one direction. Now, blood can kind of enter either from the top or from the bottom. And by the way, this is called the superior vena cava. This is called the inferior vena cava. So it's a vein, vein comes to the heart. So that's why these are going to pool in here and then pumped out. And then you see here pulmonary artery away. So veins bring blood to, and then they're gone. Same thing with the oxygenated blood. So it is going to come from several different veins. All right, this one is coming in from our body. It's going to enter the left atrium. Then it's going to be squeezed to the left ventricle, and then it's going to be squeezed out through, and we have valves involved here. So this one's called the AV valve, atrioventricle valve, again. And then this one is the left ventricle, and then it's squeezed out through the semilunar valve. So they have the same names. We'll kind of talk about the official names. But then it's going to be pumped out through what's called the aorta, also known as the aortic arch, and then it can go to basically any three locations. So that's just kind of a little breakdown of the flow of blood. And so this is the pathway in words. I think it's just easier to look at this in formula, or I'm sorry, in diagram. But here it is in words. If you want to take a look at it in words, you can certainly pause it here if you want. But let's keep on continuing. And so the right ventricle versus left ventricle, notice how they have kind of different shapes to them. That's because they're receiving different kinds of blood. They are going to different locations. So the left ventricle is very, very powerful because it is going to be thick with this wall, because remember, it is going to receive the oxygenated blood, and that's going to be pumped out a lot faster. The right ventricle is going to have much lower pressure, and that has the deoxygenated blood, which is going to be pumped basically out of the heart also. Okay. All right. So we have different coronary arteries. Coronary arteries, they're just telling us that we are, bringing blood away from the heart. Coronary veins, they're bringing blood to the heart. These are like the veins and arteries of the heart. So they go to the heart. They're supplying blood flow to the heart. They're not going anywhere else but to the heart. The reason why we bring this up is, let's say that someone has a myocardiac infarction. You might think, oh, their heart farted. No, that's actually a heart attack. So myocardiac infarction means that they have a heart attack. Usually that's because there is some blockage of blood flow in these coronary veins or arteries, and part of the heart is not getting blood flow, and that's obviously a bad thing. All right? Okay, let's talk about the valves. So they have different names to them. You have what's called the AV valves, and you have the semilunar valves. And so they're also further named after how many valves they have. So the tricuspid valve has three parts to it. And so it's going to open up when pressure, and it'll open up in threes. Bicuspid means that it has two parts of the valve. So it just opens up, and so that's how those things are named. So when we look at this in picture, when blood is flowing, all right, so here we're seeing the blood flow, the valve is open. But then once it's done flowing, or the heart doesn't squeeze anymore, then those things automatically retract, and so blood doesn't flow anymore. It's closed off. And so again, if we think of this as like a water bottle and we open it up, that means blood is flowing. When we pull back, that means that you're not flowing out water. And so that flow of water, or the flow of blood, is controlled by those valves. More than probably anything else that we have talked about in our medical science class, make sure that you look at some interactives, make sure that you look at some videos of how the blood flows. But that is our introduction to the flow of blood, specifically in the heart.